Alright, are we going?
Mm-hmm.
Hello, welcome to Southey Hill Dental Surgery. My name is Laura, I'm one of the supervisors here. And today I'm just going to introduce you all to a method of constructing copy dentures in practice without all the fancy equipment that you have at the hospital, so that hopefully when you go on to your VT year you can continue to use the method there. Okay. So, hopefully by the end of the session, you'll all have an appreciation of when copy dentures can be used and how they're constructed. I'd like you at the end of the session to be able to recall the stages of the construction, also to be able to demonstrate the clinical stages, select appropriate patients and be able to use the technique when you start your foundation training next year. So, what are your sort of feelings about copy dentures at the moment? Have any of you made any sets of them yet?
Not yet.
No, not at all. Okay. And are you familiar at all with how they're done at this practice? No? Okay, so it's a good opportunity to talk to you about that. Do you think that you'd know at the moment when they're appropriate, or would you appreciate some guidance on sort of learning when in what situations would be good for that?
I can just guess, yeah.
Yeah, so it's a bit of a guess. Okay, so when we talk about copy dentures, it's not just copying it completely. We want to copy some of the things, normally the polished surfaces, but we're basically using the dentures as a template to improve upon. So today's tutorial focuses on a technique that was developed at Dundee called the Repla block technique, that's endorsed by Coltine that make quite a lot of dental materials. So most of the things that we're using today are made by them. Okay, so let's look at the advantages to doing it. So if a patient's already got good tolerance and control of a denture, we're reproducing features of that are helpful. It's a quicker technique. It involves less appointments, and so can be more profitable. So there's one less visit for the patient, and also less impressions for the patient, because a lot of them, as we know, don't like having impressions taken. It's a really good way of communicating information to the laboratory. And there's quite a lot of information that shows that the chances of the patients adapting to the new dentures and success are better as well. It means that we can modify some of the undesirable features, and also the patient doesn't need to be without their current set of dentures, because, for example, if we were just relining their current set of dentures, they have to be without them for a period of time, which they don't like. Okay. The disadvantages are that some of the laboratories will charge quite a bit more to do this procedure, so what you're saving in time, sometimes you're losing in terms of the lab fee, and you have to make sure that your technician knows about the procedure and what you're doing, because some laboratories just don't do it and don't understand what they're supposed to be doing with it. And we found using different laboratories, some of them are fantastic, and some of them will send you odd bits of lab work back, and they've just sort of missed the point. And you can't use it at all with partial dentures, only with complete dentures. Okay. So in terms of the clinical evidence, there was a trial done by Davis and Watson in 1993 where they took 100 patients. 50 of the patients had conventional dentures made and 50 had copies done, and a questionnaire was sent to the patients afterwards, just asking them how satisfied they were with the dentures, and it showed that many more of the patients in the copy dentures group were more satisfied and had to return to their dentist for less eases and adjustments afterwards. And another study has been done where they looked at the oral health impact profile, which sort of looks at the quality of life improvement and also with patient satisfaction using copy dentures and conventional method dentures. And that actually showed that the quality of life, the oral health impact profile, was no different between the two, but the copy group reported that they were more happy with their dentures. Okay. So the evidence is there that this is a good technique that's worth using sometimes. So what I'm going to do is run through the clinical stages with you, and then I'm going to just split you into 2 groups and get you to have a go at the first stage of the practical procedure. Okay. So the first thing that you're going to want to do is go through your history, exam, diagnosis and treatment plan like you do with any sort of new patient. And also just check the condition of the soft tissues, and if you need to condition them, do that. So I just grab a couple of bits and bobs out. So I'm just going to give you some of these as well, because you're going to need these in a bit. Okay, so these are just large impression trays, okay. And the first thing that we're going to do, this is the VPS tray adhesive. There's lots and lots of different tray adhesives that you'll find in the drawers, so make sure you've got the right one. And we're going to just paint this onto the inside of one tray and the underside of another tray. And these are just normal plastic stock trays, so nothing fancy at all. Okay. The other thing that you might want to do at this point is use some green stick. Have you seen this before? Yeah. Okay. And you can melt this with a hot air burner, and just if your denture is not extended properly, you can add some here to make sure that you've covered all the hard palate and got around the tuberosities, so you can add that to that first as well. Okay. The next thing we're going to do is get some lab putty, which comes in boxes like this. Feel like I'm on Blue Peter. Okay. And you want to mix 4 scoops of this with 4 stripes of activator. So if you'd like to measure out 4 scoops of that for me. Let's get one of these that's nice and full. Yeah, so get 4 of them out. You can do this bit.
Am I going to put this?
Just in your hand.
Oh, right.
Yeah. It's actually easier to mix this in your hands than when you've got the gloves on, because it can stick to the gloves. But we're not doing anything with the cross infection risk today, so that's fine. Okay, alright Matthew, so if you just pat it down into your hand, and then we're going to use this just to put a little stamp with a circle on, like this. And this is how you measure your stripes out. So we're just going to put, you just want to hold that up so that Joyce and Toby can see as well. So we're just going to put 4 stripes there. And then if you could fold that up and mix that in, that would be great. And then if you want to start, Tom, you'd get 4 scoops there as well. So just keep folding it in there for me. You might find as well with this material that when you're doing it in summer, it sets a lot quicker, and in winter you might want to pop it on a radiator to set because it can take a while. Okay, without mixed in there. And then we're just going to push this into the impression tray just so it's nice and even. Want to do that? Okay, and when that's in there, we just push the denture in like this. Okay, so that's all nice and even. You're then going to want to make a couple of pouring holes, so you can use some green stick and just pop that onto the heels of the denture like this. Yeah? Okay. So the next thing we're going to need to do is just put a layer. Oh, you can cut 3 locating notches with a scalpel. Do you need some more?
That's all right.
You're alright? Yeah, you can cut 3 little notches here, here and here with a scalpel. However, I have forgotten to get a scalpel, so we won't do that, but you can see where they would be. Alright. When we mix the next lot of silicone to go over the top there, we don't want it all to stick together. So we need to separate the two with either Vaseline or Nivea hand cream. So the next thing I'm going to get you to do is just pop some of this Vaseline out. Just with that cotton wool bud, keep it nice and clean, and just put a layer of that over the top of everything there. Okay. So we're going to do the 4 stripes again and get you to fold it in there. Have you got the stamp?
On this thing?
Yeah. So give it a stamp, and then if you just want to pop 4 stripes onto that, that'd be great. That's fine. That'll be plenty there. Thank you. Ta. Just make a mess of it.
It's been folded, yeah?
Yeah, so keep folding that in there. Okay, and you can see on the picture on the PowerPoint presentation here how it's going to look when we take everything apart at the end. In a kind of here's one I've prepared earlier fashion. Okay, so I'm just going to get you to push that into here quite firmly, and then we're going to put the upturned stock tray on top. Yeah, give it a good push in. That's it. We'll just tidy that up a little bit there. That's fantastic, well done. So we're just going to pop this on top like this. Make sure we've got some pressure, and we'll allow that to set. Okay, so after it's set, and we'll have a look in a few minutes at that, we're just going to take the denture out of there, give it back to the patient, and hopefully it should look like this. Okay. We're going to use the shade guide to take your tooth shade and also your mould as well. And then this is something that I think trips up a lot of students and FDs, what to ask the lab for. So part of the tutorial we're doing today, I'm going to just get you to fill out a lab ticket so you know what to write. But essentially we're just going to be asking them for what are called copy denture Repla blocks with a shellac base, and ask for the second imps bite stage through that. If you want to, you can also take a bite registration at this point with some blue mousse, because we'll be doing this with the upper denture, but you'd also be doing it with a lower denture as well. So it's useful if there's some sort of bite registration sent across there. Okay. So in the lab, they're going to make what we call Repla blocks, which are sort of dummy versions of the dentures. And the way that they do that basically is to pour in the wax into this sort of mould that we've created, take out these 2 little sprues, and go from there. So when it comes back, they're going to look like these funny all pink wax dentures. And when it comes back, just have a look, make sure it looks like the existing denture and you've got the right one. Pop it into your patient's mouth and have a look at the way that it bites together and how it looks generally. And at this point, you could use soft pink wax to increase the vertical dimension if they're overclosed. Or if you wanted to increase the buccal corridor and the arch width, you could put some wax there as well. And just make sure your patient is generally happy with how these look. On from that, we're going to dry them and paint on Improgum fixative, which looks like this, but it says polyether on it. Okay, and it's got blue writing there. So we're going to paint that onto the fit surfaces and then load them with Improgum polyether impression material. You can also use light-bodied silicone for this, either's fine depending on what you've got in your practice. And then, with them both loaded, put them into the patient's mouth all together. So it's a closed mouth technique. I'm going to get them to bite and then do the muscle trimming. And when they're set, just check that everything's registered evenly and that the impressions are okay and there's no air blows in it. And if you want to use the blue mousse or stone bite to register the bite at this stage, you can as well. But normally the Improgum or the silicone will lock everything together, so it's quite obvious. Make sure you clean your patient up because Improgum does stick to them quite well, and ask the lab to return the finished dentures. Okay. When they come back, it's much like fitting a conventional denture, although hopefully they'll be successful more quickly. So just make sure there's no little bobbles or acrylic pearls. Insert the upper one, check for any pressure spots. Just make sure that everything's sort of nice and stable, you've got good retention and stability, and make any adjustments that you need to. And of course, whenever you're fitting new dentures, one of the really important things is to be enthusiastic, because if the patient's got confidence in them and you, then hopefully they'll be happy with him, and make sure they know how to look after their dentures. Okay, so we're going to have a little look at this, and then we're just going to do a quiz just to see if you know sort of when they'd be appropriate or not. So let's see if this is all set, which it should have done. Okay, so we can just pull it apart here, and you can see how it looks. So yeah, covered in Vaseline, but good job. Oh, hang on, I don't want to get this on the computer. I'll just wipe it on my trousers. This was not part of the plan. Okay, so we've got a gentleman who's got Alzheimer's disease. He's got a 20-year-old set of dentures that he likes, but they're looking really old and worn. So do you think copy dentures would be appropriate in that situation?
Yeah, because you can add to the wax to get the stuff that's worn better. Yeah.
Yeah, and obviously with the Alzheimer's disease, he's going to struggle to adapt to something that's different. So yeah. Okay, the bag of dentures patient, so an old lady that comes in with a big bag of dentures and says that there's one from 1995 and that's the only one that she can get on with. Do you think she would be a good one to do copy dentures with?
I wouldn't think so, because I suppose you take secondary impressions, but they've changed quite a lot over 20 years.
So with the bag of dentures patient, the best thing you can do is try and delegate it to somebody else, because they're very hard to please. However, if dentists have time and time again tried to make sets of dentures and never ever been able to get it right, then doing a copy of the most successful set will mean that you can get the desirable features of that, hopefully the polished surfaces, but make the fit much better for her. So that might be a good time to do it. Okay. So a lady who comes to you, she's had some dentures made. They fit really well, they're lovely and stable, but she doesn't like the teeth and she thinks they make her look horsey. Do you think that would be a good one to copy or not?
Two different ways, because you can say stability and retention is good, that's fine. But if she's horsey, then the teeth will probably far out, so you probably just need to do some from scratch.
Yeah, so going from scratch is a better plan in that situation. So people that want dentures just in case, people panic quite a lot, don't they, that they might lose their dentures and they like having a spare. So what about for a spare set of dentures?
Yeah,
It's good, although it might be easier just to flask them or something like that.
But if you want to just pass me that bag of flasks and I'll just adjust it. That's all. Yeah. So these are copy denture flasks, which you've probably seen at the dental hospital. And you could use one of these to flask them, that's right. But if you don't have these in your practice, because a lot of practices don't have them, and because this is a really simple method, then yeah, that's a good time to do it. Okay. And what about somebody that's got a lot of wear, like a heck of a lot of occlusal wear on dentures, but she's had them for 10 years? So you're going to need to make fairly significant changes.
Or I just need to just start again.
Yeah, start again. Okay, someone that's lost a lot of weight and had a lot of ridge atrophy since the last set of dentures made.
Probably not.
Yeah, time to start again. Yeah. Okay, and what about if you've got patients who've had dentures that they like, but they keep fracturing, and that's due to sort of large occlusal problems generally.
And again, you might want to look into that then and maybe start again if there's something.
Time to start again with that one. So you can see that sometimes they work really well, and sometimes you really just need to start from scratch. But when they are indicated, it's something to think about. So in summary, would you agree it's a pretty useful technique to have up your sleeve? Yeah. It provides you with a ready-made special tray as well, and it means that because you've got that record rim that looks like the patient's denture, it's building on the previous success. Great way of communicating with the lab, and less visits. And the only real downside is that the lab are going to charge you a bit more, and it's a bit more complex for them. But hopefully the trainer that you have will be paying all your lab fees next year anyway, so it's not the end of the world. So basically, just to summarise, you're going to go through the production of the templates like we did, the jaw registration, doing the wash impression in the Repla blocks, and then delivering the denture. Okay, so the next thing really I'd like you to do is just feel like you two to have a go at making one of these molds, if that's all right. So I'm going to give you the tray adhesive first, and would you find it helpful if we just talk through the stages again there?
Yeah.
Yeah? Okay. So if you want to paint some of the tray adhesive onto the top of one and the bottom of another one. We just try not to get Vaseline everywhere again.
Just plain that.
Has anyone got any questions at this stage?
What's like sort of, in terms of price, is this a lot more expensive than doing flasking, or is it similar?
I think it's about £30 different. Oh, compared to flasking?
Yeah, let's use them up.
So I don't think I've ever actually used the flasks in practice. This is the only technique I've used. The flasks tend to be something that's used more in hospitals and in some private practices. So, but I'd imagine that it's not wildly different. It's probably about the same, because both ways are making a Repla block, and what they're charging for is the construction of the Repla block, and the shellac base on that. All right, Joy, so you're going to get 4 scoops there.
Yeah.
And Toby, you can get 4 scoops, but probably don't start mixing just yet. All right, fantastic. So if you want to do stamp, perfect.
Teamwork.
That's it.
So when you do your lab request on that slide that you had, you talked about asking for special trays at the same times.
So you're asking for Repla blocks,
Yeah.
which are your special trays.
Okay.
Yeah. So there's a few things you can write on your lab ticket. Some people just put second stage copy dentures, and some people put can I have Repla blocks with shellac bases. But when we fill out the lab tickets in a few minutes, I'm just gonna tell you what to write so that they know exactly what to do for you. So just fold that in, Joyce. So just keep picking up the corners and folding it in. That's it. Just till it's all one nice even colour. The lid. Yeah. There you go. So if you'd like to push that into there for me. And then if you want to pop the denture in as well. It is a little bit slimy thanks to the Vaseline. That's it. And push these right into the heels as well there. Fantastic. Alright, Toby, and then if you want to start mixing, Joyce, I'm just going to give you this just to pop some Vaseline on. So if you just rub it all over the surface there and make sure you've got it all covering the silicone and also over the denture, because if you don't put quite enough on, you might find it's quite difficult to get the denture back out, which can be a little bit nerve-wracking sometimes.
Do you have to use these materials to do this technique?
So using Coltine Lab Putty is probably the best material for this part. Obviously in the flasks you'll be using alginate, but this is pretty much the only thing you can use if you're going to do it this way. But in terms of taking the impression within the Repla block, like I say, you can use either Improgum polyether or light bodied silicone, and either's fine. So at this stage you'd be cutting your notches in if we had the scalpel. Okay, and then Toby, if you want to push that on top of there, that's it. Just try and make sure that you've covered all the surfaces of the denture there. Brilliant. And then you're just going to push your upturned stock tray over the top there. Perfect, that's it. Okay, and then it takes about 3 or 4 minutes for that to set. And you'll find with a lot of the patients as well, because nothing's in their mouth, they're actually quite interested in having a chat with you if you explain why you're doing what you're doing and how the procedure works. So that's pretty much it in terms of the practical demonstration there. Has anyone got any questions at all at this stage?
Good.
No? Okay. No questions? Alright, so the next thing I'd like to go through with you is how to fill your lab ticket in. So this is a lab ticket for Admiral, who are one of the labs that we use quite a lot at Saudi Hill. And I don't know how familiar you all are with filling these tickets in yet. Not so much.
Not one of these.
Not done with these now.
Okay, so the first thing that you want to fill in there is your name and just the address of the dental surgery. So you can crack on and we'll do it together there. Okay, then you want to put the patient's name. So you can just make up a patient's name. The nurses are all going to be pleased this afternoon when you start filling in your own lab tickets. And then we want to, it's normally NHS patients that we're treating on your clinic, so if you just circle the NHS box, okay? And then we want to just tick prosthetics as well there. Okay, you'd be putting your shade in, so for example we might go for B1 because old ladies always like the whitest shade of teeth possible. And then you just want to put your date in. So between lab stages, it's a week normally. So we're on the 13th today. So we'd be putting the 20th of April in for the date, and I'd put that on across the trays and bite line, because that's the two things really that this produces for us. Okay, and then in the instructions, it's absolutely fine just to put please send Repla blocks with shellac base. And I think it's useful for you as well when you go into your FD practices, if this is something that you want to do, to telephone the laboratory and just ask them if they're familiar with this technique, are they happy to do it using the Dundee Repla block method, and make sure you know sort of what you're going to get back really. Okay, so that's about it really for today's tutorial. Obviously, if there's anything that you want to ask me, if it comes up in the next few weeks while you're working here and you think this might be an appropriate method to use, then by all means come and ask. So thanks for your time and for listening, and if you'd like to fill in your evaluation forms, that'd be fantastic. Alright, but thank you ever so much anyway.
Thank you.
Thank you.
It's alright.